Thank you guys for joining Chainwork TV. It's Marvin and Ash here, the Chainwork co-founders. We're here to discuss common misconceptions of physical therapy. There's a lot of myths out there, a lot of misconceptions that people have. We hear a lot of questions. So today we're going to answer some of those questions so you have a better idea of what we do and how we do it. All right, so the first thing we're going to talk about is quick fixes. People think they can walk in the clinic and they will just be healed pretty much in an hour after seeing us. Ash, what do you think? Do you hear this a lot from people when they come in? Do they think they can be healed as soon as they walk in the clinic? And then
absolutely, it almost becomes to the point where it's almost an expectation. So absolutely, I see it all the time. People come in and they always ask, "Oh, are you going to be able to fix me?" So it's one of those things I feel like I can answer for multiple therapists that are out there, at least for myself, Marvin, our philosophies here at Chainwork. There are no quick fixes. We're not here to fix you. Primarily our focus is to provide you with not only the knowledge, the structure, and yes, have those feel-good moments, but ideally, we're here just to instruct you to get on that path to where you do become healed, so to speak, but more so on your own terms, because again, we may see you, a couple times a week for an hour at a time, but majority of the week, there's a lot more hours in a day. So a lot of that's going to boil back on to the client, the patient. So again, what we do is not a quick fix. Okay.
Yeah, to piggyback off of that, I mean, there are times where people can come in and they might feel 80 to 90% better after they're done with the session, but usually it's temporary. So, we're not necessarily healers, but we consider ourselves more so educators at Chainwork. So, we'll help you feel better throughout the sessions, throughout the plan of care, but ultimately we're trying to educate you to be able to help yourself, give you the tools to put in your toolbox to, manage pain, manage injuries on your own. So there are situations where it might feel like a quick fix, but usually it won't hold unless you take the habits that we, that we teach and use them day to day.
It's like building blocks, guys. Right. We got to build a platform and then we steadily increase those blocks until you have a masterpiece, right? So think of your body the same way. That our first initial visit, those first few sessions, that's your foundation. From there, you got to continue to improve upon it, to build it, to concrete it, make it more stable.
I agree. All right. So the next question that we hear all the time, or the next misconception that's commonly brought up, is that physical therapy is only for injuries and after accidents. So Ash, what do you think about this misconception? Like, if someone's to come in and ask you this, what's your response for that?
False. Absolutely. I mean, I think this is something that, listen, we're in 2020 now. Maybe back in 10 years ago, 15 years ago, that might have been the preconception, but that's not the case now. Don't think of your body being, or having to be broken or damaged before you see a therapist. Think of it being not only proactively taking charge of things, but as a preventative, right? Think of it like cars, right? We take cars to the shop to have maintenance work done, whether it's routine oil changes, routine, getting your tires balanced and rotated, right? We don't necessarily wait till we get in a car accident to take it to the body shop, right? There's things that we have to do to maintain our car. So think of your body like a locomotor device, right? We have normal wear and tear every day. So eventually in time, things are going to happen where it doesn't necessarily mean that there's a significant injury or a surgery that has to necessarily happen. Yes, those things do come up, they come along and we address that. However, our bodies, occur and incur normal damages throughout daily work, daily activities, especially the more active ones. So, think of it more as like prevention medicine as well, maintenance, tuning up your body. So.
Yeah, I agree. I mean, people might come in for an injury at first. Like they might come in because of an ankle sprain or come in because of a shoulder impingement, right? But by the time the plan of care is coming towards the end or the issue's resolving, the treatment plan is at that point more so like, hey, let's prevent this from happening in the future, right? So we're taking from more of like a reactive type of treatment phase to more of a proactive plan in the future.
Absolutely, 110%.
So the next misconception we hear often is that I need to see my physician first. So I need to see my primary care doctor before I go to physical therapy. Ash, what's your response for that one?
No, guys. So listen, you can see your therapist first. We do have our doctorate in physical therapy, right? So we are considered a doctorate level profession. things are constantly changing and improving within the profession. However, you are able to see your physical therapist without seeing a doctor first for at least 30 days. And this is if it hasn't already been changed again.
Can we say that one to the camera as well?
30 days before you have to see the doctor, guys. Okay. We do not need necessarily a prescription to get you started. Okay. A lot of times you don't need to go that extra route. Come see us first. Maybe we can get you a good diagnosis, get you going within that period of time, rather than taking an additional day out of your time to go to the doctor, sit in an office for a while to get seen, just to get a piece of paper to tell you, okay, now you can go see the therapist for X amount of times for X amount of days, right? So absolutely, you do not have to go to the doctor first. And with the way the field is progressing, more and more people are becoming into a cash-based system, which again is kind of ruling that kind of path out. But again, there is a necessity for it, 100%. We're not saying don't go see your doctors. That's always a pathway, and we have to have those good connections, being a therapist with doctors. You want good rapport, good communication in between the two. That's what makes, everything connect.
Yeah. I like to look at us as more of like the quarterback of the entire like medical team, right? So people can come to us, we can give you our opinion on like what your status is, what the prognosis is, what we think you could benefit from, and then direct you in the right place. Maybe that's to you, that is to your primary care or your orthopedic surgeon, but a lot of the times, like Ash said, you can rule that step out and just kind of stay with us, and we can progress you to getting better. And if it comes to the point where we need to refer out, we'll refer out.
Absolutely. Yeah, we're not about trying to maintain you within if we do not feel that we are capable. We know our educational background. We know when we need to refer out. We're not about just trying to keep you because of, money, numbers, whatever the case may be. We want you to have the best care available. So if that means sometimes we need to refer out to different specialty or imaging, then we will make that decision 100%.
So to kind of segue off of the, whether or not you need to see a doctor first, misconception. We've established that you don't. You can go to your physical therapist first. Most states offer direct access to some extent. Another misconception that's kind of related to that is that physical therapy is an insurance-based treatment or an insurance service, and that anytime you go, you should use your insurance. What's your response for that when people come in and they ask about insurance?
Absolutely. We cut it short there. Absolutely hate it. Listen, not to bash any clinics out there. There's plenty of clinics that do it well within an insurance realm, and there's plenty that don't do it so well. And I'm sure we've, all either know somebody or have had that experience of being into different clinics, and how many times you feel that it's very, you have step 1, step 2, step 3. Okay, finish. You go out the door. It's almost like a very trained cycle. Sometimes it works, sometimes it doesn't, right? And, insurance is at the end of the day, again, this is a business aspect of things, right? There's a lot of other players involved when we talk about insurances. So you get a prescription. If we take it step by step from a doctor, you go in. If they write you a diagnosis for knee pain, right? We'll just go keep it very general and specific. If you go into a physical therapist's office or a therapy practice, they have to treat you for knee pain. However, what if it's something that's involved more at the foot? Maybe it's coming from the back that's causing you to have compensations or referral pain patterns. All that basically gets neglected. To a degree, we can word it how we want and try to make it to where it's finesse to where we can kind of address certain those areas. However, if we do not deal specifically with that knee pain diagnosis coming from a doctor, insurance world says no. You're gone, especially if the knee pain's not bothering you. You're out. And if the minute we show that we're not physically working specifically with the knee, we don't get reimbursed. So again, then you're out. So I absolutely do not like insurances. I think they have their place. There's a place and time for it. And they are great. They do save money for certain aspects of things. But I don't think it's the all and all. And I think that we're progressing quite a bit of ways from evolving out of the insurance realm. Again, I think it's just because we are a medical profession, and some people say it's like a more medical necessity type style, which kind of goes back into, I can only go to therapy if I'm injured or hurt or have a surgery, But again, that's not the case, guys. Think of this as preventative medicine, being proactive with your life. Think of it building habitual habits so that you don't have these issues, all right? Or at least we can try to prevent them as much as possible.
Yeah, I mean, we call the company Chainwork because we like to look at the body as a as a unit, as a integrated movement system. Not, if someone comes in and their knee hurts, okay, yeah, your knee hurts, that's where the pain's manifesting, but why? A lot of times there's an issue going on at the hip or an issue going on at the foot that's causing your knee pain. So in the insurance model, it doesn't really allow us a lot of times to address all the other things we want to address and look at the body as a whole, right? So I think, with our current model as more of a self-pay model, it gives us the freedom, it gives us the ability to treat people the way we want and have a treatment plan as long as we want without being controlled by the insurance restrictions and stipulations, right?
Absolutely.
So that's what a self-pay model can offer that an insurance model a lot of times cannot offer. So, all right. So the last misconception that we're going to discuss here is that physical therapy is painful. Ash, what's your response for that one? Is physical therapy painful? Is it one of those things where you come in and you're always in pain? You should just look forward to being in pain when you go to PT.
No, absolutely not. Listen, a lot of clients, there are techniques, there are things that we do that do create some painful responses, but it's a normal response. It's a response that 99.9% of the time we're expecting to occur. There's a reason behind it, and we need to address those reasons. So a lot of times it's, body adaptations, typically when we have painful habits. Again, injury specific, surgical specific, different story, okay? But in a lot of cases, even with those, however, it's pain at specific ranges that theoretically our body is designed to have. We're not going to take you into things that if we're not meant to be in that position, if we're not meant to achieve these positions or ranges or strengths or anything like that, we need to create that adaptability to occur, right? So things are going to be painful. However, we'll call it like a good pain, right? It's an expected pain. It shouldn't be anything that's unbearable. And ideally, you're most likely going to feel better following that brief moment of pain, whatever that we are implementing, whether it's right away that night, that day, or the following day. There's a set in place point for it. It's not always painful, but there are some things that can definitely cause some pain.
And I think it's more so like creating a mindset with our patients that don't always be fearful of pain, but like sometimes pain is necessary. Not necessary, but the relationship with pain is necessary to progress, to get better. The pain is a necessary function. It's something that our bodies have for a reason. So there are treatment techniques that we use that might be painful, but it's for the greater good. We're maybe, giving you a little bit of discomfort early on for some long-term pain, for a long-term pain-free state.
100%. Couldn't be said better. And again, going back to pain in general, right? And this is a big topic that I think is starting to kind of bubble up in the world today. There are a lot of different definitions of what pain is. So really kind of dive into that pain that you are feeling. And, there's a lot that can kind of tell us and yourself as an individual, just based off of the exact symptoms that you are feeling, and we talk about like burning pains, just like some examples. Burning, is it a stretching pain? Does it feel more like nervy? Is it sharp? Is it dull? Is it aches? So there's a lot of different ways rather than just saying, yeah, something hurts or something is painful. So again, we want to take those into account and really kind of dive into that word a little bit more.
And build awareness on what pain is and when you should and shouldn't feel it, right? All right, so those are some of the common misconceptions that we hear from patients about physical therapy, about the field, and we hope we cleared a lot of that stuff up for you guys. So be sure to come visit us at Chainwork within the Adapt facility, North Miami.
Have a good one, guys.